Hello. In this video, I will go through the DVLA guidance and fitness to fly. Actually, this topic is very important for PLAB exam, for MRCGP AKT exam, and even for, I believe it's important for most of the clinical exams, in addition to your day-to-day work, especially if you work in GP setting. So we will start with visual disorders. Before starting, you will find in the next few slides, it will be appearing like that. It will be like table, and on the left column there will be the medical condition, and on the right side there will be the DVLA recommendation. For all visual disorders, you will find there's two groups. Group 1 for the car and motorcycle driver, and Group 2 for bus and lorry driver. So starting with a visual impairment, for the group 1, you should stop driving and you should notify DVLA if you cannot read in good light vehicle number plate from 20-meter distance, and if your visual acuity is lesser than 6/12. For the group P, you should stop driving and notify DVLA, the same like the group 1, if you cannot read in a good light vehicle number plate from 20-meter distance. However, for the visual acuity, it's the cut point here is a little bit lower than the one in the group A. So in the Snellen parameter, if it is lesser than 6/7.5 in the better eye and lesser than 6/60 in the poorer eye. For the monocular vision, for the group 1, you should stop driving and notify DVLA, and then you will be able to drive later if your remaining eye visual acuity and visual field are normal. While in the group P, you should not drive and you should notify DVLA. This is the first two visual conditions. Regarding the visual field for the group 1, you should stop driving and notify DVLA if your horizontal field of vision is lesser than 120 degrees. While for the group 2, you should stop driving and notify DVLA if your horizontal field of vision is lesser than 160, or if you have defect within 60 degree right and 60 degree left between 3 degree up and 3 degree down, or if you have defect within the radius of central 30 degree. For the color blindness, there is no restriction for both groups. Regarding blepharospasm, you should notify the DLA and you should stop driving for both group 1 and group B, and DVLA will ask for consultant specialist opinion, and based on this opinion they will decide if you will be eligible for driving or not. Now we'll talk about diabetes. Diabetes, the guideline will depend on the medication of diabetes you are using. So we'll start with a patient who has diabetes and controlling his diabetes with metformin and diet. Regarding group 1, there is no restriction provided there is no more than one hypoglycemia or hypoglycemic episode in 12 months requiring assistance. For the group B, there is no restriction if there is a good control and there is no complication. If the patient is on a glycoside or GLP-1, or if he had any episodes of hypoglycemia, for the group 1, there is no restriction provided that there is no more than one hypoglycemic episode in 12 months requiring assistance. However, for the group B, there is no restriction if there is no more than one episode of hypoglycemia in the previous 12 months. If the patient has full hypoglycemia awareness, if his blood sugar monitored twice daily, and if the patient is aware of risk of hypoglycemia. So this is the first two conditions for the diabetic patient. The third one, if the patient is on insulin. If the patient is on insulin, he should notify the DVLA for both groups. And for the group 1, there is no restriction, and patient will be issued 1 to 3 year license if he has adequate hypoglycemia awareness. and if there's no more than one hypoglycemic episode in the previous 12 months, and if the patient is monitoring his blood sugar 2 hours prior to travel and every 2 hours while traveling. Regarding Group B, as I mentioned, patient should notify DVLA about his condition. There is no restriction, and he will be issued 1-year license only if there's no more than one hypoglycemic episode in the previous 12 months. If the patient has full hypoglycemia awareness, if blood sugar is monitored twice daily and 2 hourly whilst the patient is driving, if the patient is aware of risk of hypoglycemia, if the patient has annual review by diabetes consultant within the previous 3 months, and if the patient has a regular blood sugar reading. Sometimes there's form called Form D2 and Form D4. Sometimes patient will need to fill this form and submit it to the DVLA. The next group of conditions is the cardiovascular disorders. So we'll start with hypertension. If it is asymptomatic, there is no restriction for the group 1. For the group 2, patient should stop driving if his blood pressure is higher than 100 or if his blood pressure is 180 over 100. If patient is symptomatic, has hypertension and it's symptomatic for group 1, he should stop driving till his condition is controlled, and the same for group 2. Arrhythmia, patient should stop driving if this arrhythmia is causing symptoms, and he can restart driving again if he has controlled arrhythmia for 4 weeks. This is for group 1. For group 2, patient should stop driving for 3 months, and he can restart driving again if he has controlled arrhythmia for 3 months. If the patient has permanent pacemaker insertion, for the group 1, he should stop driving for 1 week after insertion, and for group 2, he should stop driving for 6 weeks. If the patient has intracardiac device for symptomatic VT, he should stop driving for 6 months for the group 1, and group 2, he will have permanent disqualification. He will not be eligible to have driving license. For intracardiac device prophylaxis, group 1 should stop driving for 4 weeks, and group 2, he will have permanent disqualification. Regarding the stable angina, there is no restriction for group 1, and group 2 should stop driving for 6 weeks. If the patient has unstable angina or non-ST elevation myocardial infarction, if the patient had angioplasty, for group 1, he should stop driving for 1 week, and for group 2, he should stop driving for 6 weeks. If there is no angioplasty or there is no angioplasty done for this patient, group 1 should stop driving for 4 weeks, and for group 2 should stop driving for 6 weeks. If the patient has CAPG, which is a open heart surgery, for group 1, he should stop driving for 1 month, 4 weeks, and group 2, he should stop driving for 3 months. If the patient has thoracic or abdominal aneurysm, it will depend on the size. For group 1, if it is more than 6 centimeters, he should inform DVLA. And this is the first condition in the cardiovascular disorder that patient should notify DVLA for. If it is between 6 and 6.5, patient will need annual review. If it is bigger than 6.5, he will be disqualified. This is for group 1. While for group 2, if it is bigger than 5.5 centimeter, he will be disqualified. This is for the cardiovascular disorder. For neurological disorder, if the patient has vasovagal attack while standing, for group 1, there is no restriction. For group 2, patient should stop driving and notify DVLA. If the patient has vasovagal episode while sitting, for group 1, patient should not drive. However, he doesn't need to notify DVLA. For group 2, patient need to stop driving and notify the VLA. So if patient has syncope and it was explained, which means that there's cause for this syncope and it was treated, and this syncope happened while the patient is sitting. So for group 1, he should stop driving for 4 weeks or 1 month, while for group 2, patient should stop driving for 3 months and should notify the VLA. For the same condition, syncope, which is explained and treated while patient had the episode while standing. Sorry. So for group 1, there is no restriction. For group 2, patient should notify DVLA and stop driving. If the patient has unexplained syncope, which means we don't know what are the cause of the syncope and it's not treated yet, for group 1 should stop driving for 6 months at least. For group 2, he will be disqualified for 1 year. He should notify DVLA and he will be reassessed after this year. If the patient had recurrent syncope or more than 2 episodes of syncope, for group 1, patient should stop driving for 1 year, while for group 2, patient should stop driving and notify DVLA. For seizures, which is one of the most important conditions, comes in the exams. So if the patient has his first seizure, for group 1, patient should stop driving for 6 months. If his EEG is normal and he stayed fit-free. If not, he should stop for 1 year and he should notify DVLA. While for group 2 patient, if patient has his first seizure, he will have 5-year fit-free first before start driving again, and he should notify DVLA. If the patient had epilepsy or epileptic seizure unprovoked, so he should stop driving for 1 year for group 1, fit-free, and then he will be issued 3-year license, and of course he should notify DVLA. 5-year fit-free full license could be issued later, and he should notify DVLA. For group 2, 10-year fit-free without medication should be fulfilled first before getting license again, and he should notify DVLA. For epilepsy and withdrawing medications, a patient on group 1 should not drive for 6 months. If he's taking medication for epilepsy and it's downgrading or decreasing due to fit-free period, so for 6 months he should not drive. If the patient has TIA or stroke, for group 1 he should stop for 1 month, and for group 2 he should stop for 5 years. If the patient has recurrent TIA or stroke, he should stop driving for 3 months for group 1, and he will be disqualified for group 2. For the drug and alcohol misuse, regarding the alcohol misuse, for group 1 patient will need to stop driving for 6 months and should notify DVLA, while for group 2, he have to stop driving for 1 year and he should notify DVLA, while if the patient had alcohol dependence, he will stop driving for 1 year and he should notify DVLA for group 1, and group 2, he will be disqualified and should notify DVLA. If the patient is using cannabis, amphetamine, ecstasy, and LSD, he should stop driving for 6 months and notify DVLA for group 1, and group 2, he should stop for 1 year and notify DVLA. If the patient is taking heroin and cocaine and methadone, he should stop driving for 1 year and notify DVLA for group 1, while group 2, he should stop for 3 years. And also he has to notify DVLA. Regarding psychiatric disorders, here we have many conditions, and there is no specific period of, stopping driving for. However, it should be, in most of cases, till the resolution or the treatment of the acute illness. So we start with severe anxiety and depression with any of the following symptoms, like a significant memory problem, significant concentration problem, agitation, behavioral disturbance, or suicidal thoughts. So patient should notify the DVLA and should not drive. And then DVLA will let them know if they will be eligible for driving later or not. If patient has acute psychotic disorder, he should not drive during the acute illness, and he should notify DVLA. If the patient has hypomania or mania, so he should not drive during acute illness, and he should notify DVLA. If the patient has schizophrenia, he should not drive during acute illness, and he should notify DVLA. If the patient has autism, if the patient has attention deficit hyperactivity disorders, so he may be able to drive, but he should notify DVLA and they will let him know what are the restrictions. If the patient has mild cognitive impairment, patient may drive and he doesn't need to inform the DVLA. And so this is the first one in the psychiatric disorder. The patient doesn't need to inform DVLA. If the patient has dementia, he may be able to drive, and it will depend on the severity and the stage of dementia, and he should inform the DVLA. If the patient has personality disorder, he may be able to drive, but he should inform the DVLA. If the patient has severe disability, so patient must not drive, and he has to inform DVLA. So for the psychiatric disorders, all conditions, patient need to inform DVLA except the mild cognitive impairment. And some of them patient should not drive, and some of them may be eligible to drive based on the DVLA evaluation. So now we are going to talk about the fitness to fly, and during that we'll take the medical condition and the time to fly, or when the patient will be eligible to fly. So if the patient has PCI, he can fly after 3 to 5 days. So we can take average 3 days. If the patient has uncomplicated myocardial infarction, he could fly after 1 week, between 7 days and 10 days, and the average is 7 days. If the patient has complicated myocardial infarction, so he should not fly for 4 to 6 weeks. If the patient has CAPG, he should not fly for 7 to 14 days, and the average is 10 days. If the patient has any of these conditions, he should not fly. If he had unstable angina, uncontrolled heart failure, or complicated heart failure, if the patient has severe valvular disease, if the patient has uncontrolled cardiac arrhythmia, if the patient has uncontrolled hypertension. So all of these conditions, patient is not eligible for fly. Regarding the respiratory conditions, if the patient has asthma, there is no problem to fly, but he has to keep his inhalers with him. If the patient has COPD, he can fly, but he may need oxygen, so he should not make them on the fly know about his condition. If the patient has bronchiectasis and cystic fibrosis, he can fly, but he should keep antibiotic and mucolytics with him. He may need it during his fly or his travel. If the patient has flu, he should postpone his flight till he improves. If the patient has pneumonia, he can fly if clinically improved and there's no residual infection, plus if he has satisfactory exercise tolerance test. If the patient has pneumothorax, he should not fly for 2 weeks after drainage and full lung expansion. And usually they recommend, if the travel is not mandatory in the patient with pneumothorax, he should delay it as much as he can. For neurological condition, if the patient has a stroke, he should not fly for 10 days. Sometimes if the patient is stable, he can fly within 3 days from the episode. If the patient is pregnant, if she is pregnant, the lady is pregnant, so it depends on the pregnancy, if it's a single baby or twins. If single baby, she can travel till 36 weeks. After 36 weeks, she will not be able to travel or fly, sorry. If the patient is pregnant in twins, she should not fly after the 32 weeks of gestation. One more important point, most of the flight company will ask for certificate if from the 28 weeks, if I'm not wrong, I think from 28 weeks. They will ask for the certificate if the pregnant lady will travel. While the restriction apply if the single baby, no travel after 36 weeks. If twins, no travel after 32 weeks. For the hematological condition, if the patient is anemic, his hemoglobin should be above 80 to be safe to travel. If the patient has sickle cell anemia, he can travel, but he may need oxygen, like COPD cases. If the patient has sickle cell crisis or attack, he should not fly for at least 10 days. And lastly, for the surgical conditions, if the patient has surgery, if the patient has laparoscopy or colonoscopy, he can fly after 24 hours. If the patient has plaster cast, so he can fly within 1 day if flight will be less than 2 hours in duration, and he can fly after 48 hours if the flight will be more than 2 hours in the duration. And abdominal surgery, patient can fly after 10 days of the surgery. Finally, I would like to thank you for watching this presentation, this video.